Imagine one day you suddenly start seeing black dots or shadows that move with your gaze. This is exactly what happened with my patient recently, who came to me very concerned. Was this something harmless or was it a serious vision problem? In this video, I will tell you his story and explain what these floating dark spots actually mean. He shared that he was seeing small floating shadows in his vision, especially when looking at the sky or a white wall. These moving spots are known as eye floaters, or in French, mouches volantes. They are actually tiny particles inside your eye, in the vitreous. The vitreous body is a gel made up of 98% water and 2% collagen and hyaluronic acid. Over time, it naturally ages and liquefies. When the collagen fibers clump together and light enters, these deposits cast a shadow on the retina, and the person perceives them as floating dark spots. Now that we know what causes these floaters, let's go back to my patient that I mentioned earlier. During the exam, I dilated his pupil so that I can thoroughly check the retina and the vitreous body. Luckily, there were no hemorrhages, no retinal tears or breaks, or no retinal detachment. The patient had only a vitreous detachment, which we were able to manage together. Actually, a vitreous detachment is quite common with age and is not directly considered a disease, but rather a condition. However, it is important to rule out other diseases that may occur alongside it. So if the eye floaters are not caused by any retinal pathologies, they are usually harmless. Even though they are permanent structures in the vitreous body, eventually most patients adapt to them and stop noticing them. In some cases, the floaters may even sink out of the visual field or break into smaller and less noticeable parts. So how do we recognize this? If you've been seeing those spots for a long time and their number hasn't changed significantly, there is usually no cause for concern. But if suddenly many new eye floaters appear, or you see flashes of light, or you experience some vision loss, then you should immediately see an eye doctor, just like my patient did. Now I want to hear from you. Have you ever seen these floating spots? And do you want to know what you can do about them? Write your questions in the comments. Subscribe to the channel so you don't miss any new health tips. And see you soon.